The healthcare system in the US has been flawed since World War II. If you look at any metric like related to outcome for how we take care of chronic disease in this country, we don't compare with a lot of other countries in the world. And I would contend that 80% of the reason why that is the case is because of how dysfunctional the system is at every level. Incentives in healthcare that are perverse are real. Private equity and money and politics have really done a serious disservice to our healthcare system. When we have the COVID pandemic, you see very clearly how broken the system is and how the system doesn't actually work for anybody. So there's a shock to the healthcare system. That's what we're experiencing. If you have a high functioning system, then you're able to weather the shocks. And in fact, maybe as a result of the shock, you're actually a better system for it because you're proactive. I really think about the system as being reactive.
The customer has a disadvantage when it comes to medicine. And I think one of the biggest issues in the healthcare as we have it is a lack of education for the customer and a lack of transparency. If you needed to go to the emergency room, do you know what you're going to pay? So the biggest question for me is, why isn't there a price list? Good quality care for less cost. And that's been at the center of the debate. The problem is the system itself doesn't allow for that very well. So let's say there was no healthcare system and you had all of these historic examples. How would you do it from scratch? So those are the kind of questions we should be asking ourselves.
People with lower incomes are unbelievably impacted by any economic shock, whether it's related to the pandemic or not. They have healthcare, but it's not the healthcare that everyone else gets. It's like the other plan, It's like the plan where you wait a year or two to have surgery.
People with lower income are hugely affected by a pandemic, more so because majority of their income really goes to survival. When I say survival, I'm talking about your basics: food, shelter, water, things that some people take for granted. One of the reasons I recognize that African Americans have a disparity is because COVID has really exposed the underlying ailments and conditions. It's not just COVID itself, it's the underlying things that are speeding up or exacerbating: diabetes, heart challenges, eating a lot of fatty foods, fast foods. And so this has really woken the whole American culture up. There's a responsibility that needs to be taken as it relates to eating properly. I think it's about proximity. And what I mean by proximity is about the relationship or to where those individuals stand or where they live. And so if you live in a community that's not of color and you're having a conversation, let's say, about veganism, and the community of color is now having a huge conversation about veganism, but let's say they wasn't, or that individual who was your patient is going back into an environment, proximity, that's not having that conversation, that could be a challenge. So communities of color, from my perspective, have a huge diabetes, you name it, just different ailments. It's mainly lifestyle, fresh foods, fresh vegetables, access. I'm sure you've heard of the term food deserts, going into local communities where there's not a lot of fresh vegetables, a lot of fresh produce. That's a challenge. Why are maybe communities of color suffering disproportionately more is because of access. And so corporations or the medical community or whatever industry, when they recognize that there's a disparity, then I think we'll see communities change. I've been studying the challenge of communities of color not having food as it relates to food deserts for years. What we really come to understand is it was education, it was awareness, raising the awareness. And once you raise the awareness, you had corporate organizations respond, not react, they responded. Awareness, education, access. The pandemic in its current situation has raised the awareness of the disparities. But we don't need another study. There's been plenty of studies that says there's disparities. COVID-19 has reawakened and pulled the cover back, like I've said, and exposed it again. But we don't need to go back to have more studies about the study about the study. Implement the study.
If you're not in healthcare, it's okay. You can still help. You can vote. You can talk to your local politicians. You can talk to your hospital administrators, and you can start getting them to talk more about ways to solve the current crisis, not reacting to a broken system.
There are a lot of older folks around that are particularly at high risk. And I think if everyone sort of had some sense of responsibility for others, I think we can get through this. And I hope we can come out with at least as many positives, if not more, than some of the negative things this kind of crisis can bring out. That's my hope. Whether it happens, I don't know.